Okay, good morning all. Thank you for joining us with another session of the Coffee with a Local Healthcare Leader. My name is Elena Smith and I sit on the Early Careerist Group Committee for IHIN. I'm going to go ahead and share my screen. Can you all see my screen okay? Okay, here was our flyer for today. We have Kevin Black, the Director of Regional Operations at St. Vincent Medical Group. And before we get started, I would just like to give recognition to our sponsors, because without them, really, it would be really difficult for us to continue on with different programs and events that we put on. So I just want to say thank you to our sponsors. Premium sponsor, Ice Miller Legal Counsel. Platinum sponsor is HEPE. Gold sponsors, Innovative Care, Arc Design, KSM, and Cornerstone. So thank you. And then I'm going to stop sharing. Okay, and then we're going to jump right in. I'd like to give an introduction to Kevin. Kevin Black has 32 years of experience in ambulatory care and physician practice leadership in large integrated health systems. Kevin's experience includes leadership positions at Health Partners, including Minneapolis, St. Paul, Mayo Clinic, Rochester, Arnett Health System, and currently Ascension Medical Group. Kevin completed his bachelor's degree in business administration and his master's in healthcare administration at the University of Kansas. Kevin completed his postgraduate fellowship in hospital administration in Kansas City and has been a member of ACHE since 1987. So thank you, Kevin, for joining us this morning as we spotlight you and hear what you have to say to our early careerists and other healthcare leaders on the call. So to get us started, will you continue to tell us about yourself and the organization that you work at?
Well, yeah, thanks, Elena. Thanks for having me. I appreciate the introduction. I'll just extend that a little bit. So as Elena mentioned, my entire experience post-fellowship has been in ambulatory management, physician group practice in large health systems, larger health systems like Arnett and Lafayette, and Elena mentioned Health Partners in Minneapolis, St. Paul, and Mayo Clinic, Rochester. So really through those 32 years, I really have come to enjoy and embrace the experience in ambulatory practice management. And I mentioned my fellowship in hospital administration was very much an acute care setting experience. And that's where I thought my career would go. And that's how I envisioned my career, as being in a hospital and being in acute care. But it was through an experience during the last part of my fellowship that I was introduced to the opportunity to work with a group of physicians that the hospital had acquired. And through that last 9 months of my fellowship, it gave me enough experience to take a position in Health Partners in 1990. So that was it was somewhat unpredictable, but it turned out to be a rewarding career path that I've enjoyed. So I really, again, appreciate the opportunity to be a healthcare leader and to really be part of a member and a leader in the community to really improve the health of our communities and our population. So excellent. Thanks. So on the fellowship experience, I mentioned that, I touched on that briefly. The first 9 months was a traditional, what I call traditional fellowship, where you rotate through the clinical departments, administrative departments. We had a joint commission survey that I was responsible for certain components of that. So, very traditional in working on a couple projects with leaders in the hospital. But the opportunity to work with the physician practice and to be really the practice manager was very daunting. It was something that I was not familiar with, and really through that experience, really launched an opportunity to work in physician practice management and ambulatory care leadership. So that was really, I think, a pathway that I hadn't originally intended. So really, I think back as far as the pathway that we take, and something perhaps folks are contemplating now as far as what area of healthcare do I want to go into, and what do I want to explore, but how do I see myself in 5, 10, and 15 years? And I think there is a little bit perhaps of fear, and I experienced this as far as picking a pathway and having that then project you into a career that you I want to say find yourself in, which, if I had to go back and look at things, I think I would have been a little bit more intentional and a little bit more deliberate. And I absolutely am convinced that the network, the relationships that you create starting in undergraduate programs through graduate school and through whether it's an internship, your first job, or fellowship, I think the higher the more contacts that you have, and the more, I would say, the more relationships that you develop will provide a commensurate increase in the number of opportunities that you have. And that is a hard task. I know everyone's heard so much about networking and so much about career management, but something that I started to do, I think perhaps a little bit late in the game, is a 3-folder concept. And I keep basically 3 folders on my laptop. You can store this anywhere. But one folder is basically the people in the organizations of interest. And these could be people that you've met, could be at a conference. It could be in a hallway conversation with a part of the organization that you usually don't come in contact with. But making a note of that and identifying that as, this is someone that I'd like to learn more about, or an organization I'd like to learn more about. Keep a folder there. The other thought is just on when you receive recognition, and it could be an email just thanking you for work on a project or a compliment. Really, I mean, three parts of that I think is an opportunity to do. One, it can make you feel better if you're having a tough day or a tough week, to go back and look at that occasionally. But I think most important, through that, you can generate a contacts list. You can generate a reference list of going back to people that, hey, they took the time to write an email to me thanking me for my work on this project. Is this someone that would be a resource or a contact that I could reach out to and connect with in the future? And obviously maybe a reference in developing that relationship. So that's the second folder. The third folder is ideas, and never discount the power of an idea. And when you're in the moment, this can be absolutely during your education, during your training, during your early career opportunities and experience, just tucking something away. I mean, I'll use an example that I pulled back from a first-year business school class in undergrad, where we used basically learned how to use regression analysis. Fast forward about 28 years to Health Partners, and we have basically a patient satisfaction survey, medical GPS, and there is basically we call the cardinal, or basically the overall satisfaction. It can be our CMS evaluation of our providers, basically overall performance. And then we have questions that support this basically this overarching metric of provider basically satisfaction and loyalty to a provider. So what factors, or what parts of the patient's experience had the highest weight? In statistical speak, it would be a highest correlation coefficient. And that was useful, but it's amazing, that idea. And it could be something you're experiencing now. Maybe there's an opportunity in how the organization is designed. And maybe as a fellow, for example, you have the year of the president. You see an opportunity on the white space in the organizational chart to look at maybe a different type of opportunity, or a matrix opportunity. But whatever that may be, never underestimate the value and the importance of your ideas. So ideas, people in organization, and recognition. I keep a file where someone says, great job, put that away, and always keep that. Maybe keep that on your personal device as far as storing that. But I think that's important. And really it ties in with the college and the certification process. The process of certification is I think is very valuable, and it's helped me in ambulatory care leadership and management, where I work with, and my team works with hospital administration very closely. We have providers in the hospitals, and understanding the hospital world, where quite frankly the exam, the Board of Governors exam, is still very much weighted in basically acute care management. I think it's been a while since I've taken that. I became certified in 1996, but having the perspective is important. Having those contacts is very important. And all these things intersect. Everything's interrelated. Never underestimate the interrelationship of your ideas, recognition, your experiences, and your experience with the college. And try to be attuned to where those relationships connect in your current experience and the experience that you want to have in the future. But it is a fun time. It's a great time in your career. And I know it can feel daunting, but try to piece together all of the pieces of what you enjoy and where you see opportunities. So really, I think, again, the fellowship experience has been, like I said, been very rewarding as far as the contacts, the relationships. And even if I have a question that I'm working in basically a specific, I would say, content area, I'll reach out to someone that you can research through the ACHE and find and look to that individual. And I think the importance of the Indiana Health Executive Network is also even particularly vital because of the proximity of the individuals that participate. That I think you're in a market that is facing the same challenges, whether it's the regulatory environment or demographics, access to care, barriers to access to care, I think can be very similar, where I think whether it's community or IU or the Franciscans or Ascension, I mean, we face a lot of, face challenges being entrusted with the care of the populations of the communities that we serve. So really use IHEN as a network at resource. So all of those together, both the college at the local level, regional level, and the national level, is really a resource and an asset that I find very rewarding. I see Allison Aboski is on the call. She just recently became a fellow and is on my team and supports a number of our practices in the Northwest region. So it really is something that I encourage, and it's obviously rewarding to be part of an organization that values the credential, where you have members of the organization that participate in the college and help you and lift you up in being part of that pursuit of your career. So I'm moving to these questions really quick. I hope you guys have some great questions, some challenging questions, because I'd like to hear more from you than basically to I would say over talk what I've already shared. So with the last thing I'll touch on this morning is where I see an opportunity for change, where I see an opportunity that I think is important. And it's become a cliche as far as increasing level of integration, but I think really stripping it down to what that means. It really means connecting with the patient, the patient's family, in their community, and providing the most value in the most cost-effective way. And I think definition of value is the quality of the product, basically divided by the cost of that product. And it really, there is such an opportunity there. And unfortunately, I do have a bias that I believe that there are certain parts of our industry, certain segments of the industry that provide value to the patient, family, community, where it's a better value than others. So I think where there's an opportunity to remove intermediaries longer term, and this is very global macro, but if it's a segue for questions, great. If it's not, we'll wrap this up shortly. But where we have, for example, Ascension is the largest health system, not-for-profit system in the United States, with 150 hospitals with 100,000 associates in 22 states. Ascension, Indiana has 18 hospitals with approximately 1,700 providers. And with that size, I always wonder, and I think Ascension would love to move this forward. I can only probably underestimate the barriers, but creating their own insurance product. And this is what Health Partners did. It actually made a lot of progress in the early 90s, where they didn't contract with United and Aetna. They were their own insurance company. They came to be by them, basically the merging of an insurance company, MedCenters, with Group Health, a staff model HMO, to become Health Partners. Health Partners went on to acquire hospitals, where the hospitals became basically cost centers in the system. And the employers, instead of going to Aetna or to United or to Anthem or Cigna, they went to Health Partners, and they purchased their entire healthcare that the Health Partners provided. This goes back to 1994. So I know we're not quite there. Regions are different. Culture and the practice of medicine is different. But I am really intrigued by how we get to the patient, as they say, where they're at, but in a way that provides the right care at the right time. I think is at Don Berwick, but I think is a huge opportunity. I'm really intrigued by digital means of connecting with consumers and patients, and really providing that care when they want it, and when they need it, but when they want it. So, Lena, I'm going to stop there and give us more time for questions, and I can go back and elaborate. I know that's been has been a conscious stream. So,
Yes, thank you. Thank you so much. It's a lot of great information, and you touch on, that fellowship experience and how it turned out to go really well for you. I know a lot of early careerists are in that decision making of, do I go straight into my career? Do I go fellowship route? Do I go to grad school? After grad school, do I go fellowship? There's a lot of different options. So I think it's really important to hear out from different perspectives of people who went through a fellowship process versus didn't, and just talk about pros and cons of both. So thank you for touching on that. I'd like to hear more about why IHIN and ACHE is important for early careerists. Looking into career goals, it would be great to become a fellow like yourself, but obviously that takes some experience and it takes time to be able to even sit for that type of test. So can you just touch on why it is important to, join right out of school, or while you're still in school? We have a student membership as well for those students. Can you touch on that?
Yeah, no. And we had even though our program was relatively new, we did have an active student chapter of the ACHE. So I think as a group, we went to the Congress together, I think a couple of years during graduate school. So I mean, I think that level of connection with your colleagues, fellow students, was very, very important. And we're all asking the same questions as far as, what next, what opportunities they are. And I think the college does help form, I think, a structure to provide that insight into opportunities and into, through their publications, through their basically educational programs, offer opportunities to explore the industry. Because I think, I think it's only understandable that our graduate programs in healthcare administration are undergraduate programs in healthcare administration, including particularly, programs that I think are fantastic in public health. Wanting to be as inclusive as possible. I think everyone has so much to bring to the profession, but you don't learn a lot about. I think this is probably true for most professions. You don't really learn a lot about getting out and working in organizational life. Actually, our curriculum in our programs really doesn't spend a lot on, maybe other than organizational behavior or management, spend a lot of time in the challenges and the complexities of organizations. And I think the ACHE provides that segue. It gives you a roadmap. Well, first of all, what are the organizations? What's relevant today? What will be relevant tomorrow? And it starts to form, I think, questions about the industry. So it's not, it's a beginning, but it's not the end, and it's a process. And like all things that I think are important or vital, it is a process. And think of the ACHE as that, both every level, local, IHE, and basically the college nationally. I think that's very important. So it provides those. Basically, I think those insights into learning more about the industry, but then also, I think very importantly, I think what the college does, I think very well, is identifying the value of being recognized as a board certified healthcare executive. And I think as our provider counterparts have professional accreditation in their respective specialties, I think being board certified in healthcare is something that I think is important, and I think is recognized by physicians. I have physicians during the course of my career that have asked me about the college and even explore the college, and particularly where we've seen more physicians enter, whether it's in our acute care settings, whether it's an integrated system, not excluding acute care and ambulatory care, physicians that are becoming leaders in our organization. So I think developing those relationships, your younger physicians are often leaders of the future. So I think the college is a wonderful bridge to develop those relationships as well.
Thank you. I'll take a moment to see if I'll check the chat to see if anybody has any questions, or if you'd like to come off mute for Kevin to go ahead and ask any questions.
Hello, my name is Lisa Foreman, and I am a new graduate with my MBA in healthcare management. I had a question about how do you segue into that trajectory on the administration, management, leadership course? How do you segue into that from I've been an entrepreneur for 4 years, and I've also had 16 years of critical care experience. How do you segue into that industry?
Right, Lisa, I think you identified a fantastic resource in your critical care experience. So I think looking at, and I'm probably sharing something with you that you're already doing, have contemplated, or you're probably well far out ahead of. But I think looking at your work in critical care medicine would be I think a natural segue. I think one of the questions is that an area in, let's say, acute care, hospital-based, and I'm not going to necessarily suggest, and absolutely never just only nursing administration. It's a fantastic area with so many opportunities and needs. But I think using that as a way to enter an organization, to explore an organization, and to emphasize, I do have this background, but I'm interested in doing this. But I think the challenge is finding that sweet spot where an employer has interest in you because what is unique about you and what you can bring to that organization. So finding some way to bring that critical care nursing background to an organization that you're interested in doing. So just a question for you, Lisa. So 5 years from now, describe your perfect job. What would you love? What would you want to do?
Actually, 5 years from now, I'm really interested in trying to get into the finances of an organization. So, in 5 years from now, I'd like to pursue my CPA. I honestly do, so I can go into like a CFO position.
All right, that's fantastic. Well, I'll relate something real briefly. So during my actually reason why I went from undergrad, I took a 6-month hiatus, went into basically a management training program at a steel company in Kansas City. Did not like it. Went back to graduate school. Chose healthcare because I thought I would differentiate my undergrad in business. All my friends had MBAs, weren't getting jobs. So I thought I'm going to pick healthcare and try to focus on an industry and distinguish at least an interest and a commitment. And during that time, I took quite a bit of accounting classes. I was 2 classes short of sitting for my CPA in the state of Kansas, a class in audit and 1 advanced class in financial accounting. The point being is that I used that interest to do basically a 12-month, basically a concurrent internship with Pete Marwick, Maine, in Kansas City. So I was in their healthcare consulting division with Pete Marwick, where it was basically audit, tax, and consulting. And I got on the consulting side using that background in that interest, and really thought about the financial track, thought about getting my CPA. But that really helped with the fellowship, and it helped with everything builds, and everything, like I say, is interrelated. But Lisa, I think one of the things is that I don't know if you looked at what it would take to go back, and it's maybe not as much as you think to go back and to just basically check with the state of Indiana Board of Accountancy and explore what the specific classes are to basically sit for the exam. And that's a big commitment. I realize that that's an option, but never discount a course that you never maybe initially thought of or invested in. But it sounds like you're maybe halfway there. Have you done that type of investigation?
I actually have. They said that I needed 150 hours,
Wow. Okay. Yeah. Yeah.
and I think I'm there. So,
Right. So you mean, how many of those hours have you completed?
well, I haven't completed anything. I've
Okay. Okay. Yeah.
literally just got my MBA, and then I was researching the CPA part because I am looking 5 years into my future.
Right. Right. Well, you can guess my age, but time goes so quick that 150 hours may seem basically really very, very daunting, but that is absolutely achievable. If that's where your heart is, I would absolutely find a way of doing that. So, and there could be other options as far as how to find and achieve that path into finance and healthcare. So, excellent.
One more question. What entry-level position do you think I need to pursue to be on that course? Do you think I need to pursue an analyst position at this point?
I think an ascension has, and it is we refer to individuals in finance that basically provide basically reporting or analytical support as analysts. So that would be a very good role to pursue as far as working in the finance department. That could also be in project management, where the content is analytics and business, finance, accounting. But I think that's an excellent idea. And to do that while you pursue your education, as far as I know you have your MBA, but as far as getting your hours for the requirement for the state board.
Thank you so much for the
You're welcome. Thank you.
Have a great day.
You too.
We have just a few more minutes. Does anybody else have another question? I do have one if nobody comes off mute or puts in the chat.
I have one more question. Lisa again. Sorry. What do you think is the most challenging thing that's facing healthcare in the future?
Yeah, I think it's the segmentation of different parts of the industry that do not achieve what I believe is that next necessary step in the progression of how we provide healthcare in this country, and that it's more than a higher level of integration. It's providing value to the patient. And I think whether you're basically a Fortune 500 insurance company or an acute care system, I think the incentives that we operate in healthcare, I think, can be perverse and counter to what is best for the patient. So I think that segmentation is very difficult. In other words, I find out what the incentives are for me being a CEO of an insurance company, for example, and then I maximize profit based on those incentives. And I'm biased by this. I apologize for anyone I may offend, but we all, I think, will have to, and our leadership requires us to work to the financial incentives by design. I think that's a structural limitation of our current system. So I look forward to a day where we have less segmentation and a higher level of focus on providing value to the patients. Maybe that means larger systems like Banner Health, providing that pillar to post integration for the patient, eliminating waste, and really doing what is right for our patients, their families, and our communities. So I think specialization is really, I mentioned I'm interested, I think I'm intrigued by some of the technology around reaching out to consumers on our technology platforms. But really, at the end of the day, it's providing patients where they're at. There are different ways of doing that. But at the end of the day, it's that, did we provide that patient the care that they needed when they wanted that, where they wanted that? I think that's the big challenge.
Thank you, Kevin. And thank you for everyone joining us today. Thank you, Kevin, for letting us spotlight you and hear about your career thus far. We always wish well to in all your endeavors the rest of your career. Everyone be on the lookout for our next Coffee with a Leader, hoping to schedule for August. Thank you all and have a great day. I'll stop recording.